All right, well, welcome everybody. I'm Communications for World Spine Care, and I'm joined today by Dr. Patricia Tavares, our clinical coordinator for the Dominican Republic. Welcome, Pat.
Thanks. Nice to be here.
We are participating today in the World Federation of Chiropractic's Biennial Congress, which is virtual this year and is taking place in Central Standard Time, or Daylight Time. I can never get those correct. And it's in partnership with Parker Seminars. And they're doing a great job, a great live stream. A few sessions have already happened. And later today, Pat's presentation will go live at 12 p.m., which is that 1 p.m. Eastern Time, right? Okay. And 10 a.m. in Pacific Time, which is where I'm at. So I just wanted to introduce Pat and let everyone get to know her as the clinical coordinator of our clinic in Mocha, Dominican Republic. And then we'll talk briefly about the presentation that you'll be giving later today. So how did you get started with World Spine Care?
So I work for CMCC, and I was taking students down to the Dominican Republic on outreach missions or outreaches. And I had gone in 2012, and when I returned, I went again in 2013. And when I returned, I was speaking to the dean of the school, who told me that the MD who was bringing down students and accompanying us and setting us up for the outreaches had been talking to Scott Haldeman of World Spine Care about setting up some sort of permanent clinic there. And my ears perked up because I had just gone a couple of years already, and I was so interested in the population I was seeing. And I thought, where has this been all my life? And so I said, how can I get involved? And she said, well, why don't you try contacting Scott, Dr. Haldeman? And I did. I just emailed him and said, how can I help you? Because I know the contact down there and I've been there, so I'm familiar with the area. And it just went from there. He said, here's the many things you need to do to get this going. And then I started on that journey, which lasted a while. And of course, all the help I got from Jeff Outerbridge, who had set up in Botswana and had all the knowledge. And so working with him and Scott Haldeman and Dr. Lopez down there and various other people took about a year and a half to set up a clinic there.
Great. So how long has it been since the clinic was formally established?
We started officially in November of 2014. We started seeing patients. Our one-year clinic supervisor, Dr. Eberspecker, really started seeing patients in, I think it was mid-December, because we had to get all of our equipment down there. It had to be shipped down, so on and so forth. So that took some time. But yeah, patients started coming at least a month in, and it just went on from there.
Great. Yeah, so it's been almost 7 years since that clinic was opened. I was just realizing it's been 10 years since the first clinic in Botswana was officially established. So we're going to do something special for that later this year. And so altogether, World Spine Care has established 6 clinics in 4 different countries, in Botswana, Dominican Republic, India, and of course, like many other organizations with the COVID pandemic, things have been in flux. And so the volunteers that were in the Dominican Republic were really strong-willed and stuck around for quite a while.
They did. Yeah.
But what ended up happening? Where have we been since then?
We had 2 very competent volunteers, and we were excited to have them, one from the US and one from Denmark. And unfortunately, the pandemic hit, and our volunteer from the US went back because he was being told, go back. And then the one from Denmark stuck around as long as she could. But eventually, she just said, I have to go. And of course, we want to make sure that our volunteers are safe. And she made the decision to leave a bit later than our US volunteer. And then we've been closed ever since, unfortunately.
And the clinic that the World Spine Care Clinic is within, it's within this Patronato de Rehabilitación. Yes. That was closed for a time as well, which kind of forced us to close. Right. Yes. And so then the volunteers, reasonably went home. And but we're kind of to the point where we're ready to open it up.
We're ready to open it up. So you are willing to go, and your safety is our concern. So if you are happy to go and we're ready to take you. Our clinic can be fully operational down there. The rehab center that it's housed in is fully operational. I mean, they're not at 100% capacity, but they're probably, I think I was last told, at about 80%. So it's we're ready.
And we've got the apartment, we've got, all the supplies and things down there. I think we do need to send a new laptop. That's one thing that we were in the middle of purchasing, and then the volunteers left. So
yeah,
but otherwise it's ready.
We have a car down there for transportation. We have a lovely support network of people that help us out all the time on the ground. We can hook you up very quickly with a support system down there.
So if you're ready to go to the Dominican Republic, check out our website, worldspinecare.org. We've got a new website coming in just a few days. I'm excited to launch that. There will be all the information about what the volunteer opportunities look like and who to get in touch with. You can get in touch with Pat or with Kate Graham, our Director of Volunteer Operations. But to further the discussion about COVID and this difficulty of treating patients during the pandemic, World Spine Care put together some guides, which also are available on our website, on distance management of spinal disorders and helping clinicians and patients alike find ways to sort of triage and to address that. And that's what your presentation will be on today. Can you tell us a little bit more about what you'll talk about?
Right. So a group of us, Nathan included, we wrote a paper about which the objective of it was to describe the development and present the components of these 2 patient guides that are evidence-based for the management of spinal disorders, where in-person care isn't available. And of course, it was sparked by the COVID pandemic, but of course, it can apply in many situations. Yeah. And I'll talk about the guides, the patient guide, which is easily available on our website and has been shared in other platforms or on other platforms in the world. And so a patient can go on there and follow the steps. The patient guide is a 2-step process. Asks the questions, you answer the questions, and then it tells you basically what to do after that. So if you're in a certain category, you minimal pain, it'll tell you what you should do. You answer a few questions, and then it'll tell you what to do. So for many of the categories, you would be doing some self-management. We direct you where to go to do yoga, Tai Chi. You can manage your own pain because likely the mild or moderate pain will self-resolve with a few things that you can do. And then it will also direct you to more severe pain and neurologic symptoms that you're experiencing. With those, it will direct you to reach out to a clinician on telehealth or to go to emergency if it's appropriate. And so you just basically follow the guide. It's like a cookbook, and it'll tell you or it'll give you advice on what you should likely do. It doesn't stop you, of course, from contacting your doctor at any time. It doesn't go against that. It just gives you a guide so that it sort of maybe lessens your worry if you're worried about something when it's hard to get an appointment with your doctor.
Right. It's really meant to empower the patients to self-assess with the help of a qualified healthcare practitioner. And it's not specific to telehealth, right?
No, it's not specific. I mean, telehealth, telephone call, online sort of it's not specific. You can do it even before you go visit your doc in person if you wanted to. You can certainly be empowered with, well, I have mild pain, it's not radiating, it's only been there for a week. Maybe I can do a couple of self-management things. I can be assured that it's probably going to go away and I can relax about it a little bit. And then I'll see how it goes. And I can go from there. I can call the doc maybe a little further in the future. Something like that. It can help you even if you're going to visit your doctor and decide when to pick up. Yeah. Because sometimes we find it hard in this environment. Docs will see you, but maybe not for a while. And so it might be wiser to go through the guides first, just to reassure yourself of what you might be dealing with.
Yeah. I have an appointment that's been scheduled and it's, 2 months out. for a telehealth appointment. So, yeah, things are tight. It certainly can be applied, if for those who are interested in providing care in more rural areas. The same principles can apply, and we really want to empower the patients as well as clinicians to understand really when it's necessary. And fortunately, things with COVID are getting better, and so hopefully access to hospitals and clinics is much more readily available. But in the many places around the world where they're not, this can still be valuable at any time.
Absolutely. And in places where we have clinics, but we don't have clinicians right now, this would be
Exactly,
a
yeah.
great thing to do until we can get someone down there. And if you're in parts of the world where things are just not available to you, at least this will help you a fair amount. We hope.
Well, the WFC Congress was started this morning early for me at 6 a.m. There have been quite a few presentations. I saw one from PCORI, the Patient-Centered Outcomes Research. And our other clinical coordinator down in Botswana gave a presentation earlier this morning about underserved communities. What else are you looking forward to? Or what have you seen that you enjoyed?
Oh gosh, I've enjoyed everything so far. I definitely enjoyed the PCORI. I didn't know that organization, and now I do. I liked the talk by Jeremy Howick. I thought that was great. When he's talking about kindness and the power that kindness has that you exhibit to your patient, and he described sort of what kindness meant, because he says it's hard to define. And he talked about studies which showed that when doctors were being kind, the outcomes were so much better than when they weren't.
Interesting.
And so that's
very interesting, yeah.
It's very people-centered or patient-centered, which is great. I mean, we think about it, but we don't. Sometimes we're having a quick day. We've got other things on our mind, but we really have to keep that kindness idea in our heads. And in a small amount of time with kindness, you can make a huge difference to your patients, perhaps. So
that's very cool.
It was a good reminder to self-reflect, right?
Yeah, absolutely. We do have, I'm trying to remember if it's today or tomorrow, Scott Haldeman will be presenting on the use of telehealth. Anyone else, a number of other people involved with World Spine Care have been presenting. Bart Green will be on there. Stephen Passmore was on the presentation with Mafudzi. Anyone else that I'm missing?
Yep, Deb Kapansky-Giles will be on. Mike Schreck will be on. He was on the paper with us. He's going to be in a breakout session coming up now. There's a number of people. So I'd have to look at the program to tell you exactly what.
Yeah.
But so I know GMUSC. Deb is speaking, I think, on the work of GMUSC.
Is it on the new report they just put out?
I think so. So we'll see.
I would imagine, yeah, towards a global strategy for reducing musculoskeletal pain or something. I can't remember exactly the title. It's a big one, big work. Well, great. Well, I'll let you get ready for your presentation. I know you'll be there to be able to answer questions, and looking forward to it. Thanks for joining me on this break chat, and we'll see you on the virtual conference.